All right, so there's been new information came out about the COVID vaccine. It's funny because the pro-vaccine guys are talking about how COVID vaccine saved 2.5 million lives because they just decided, and then it's curing cancer. But the actual research that came out, the FDA knew before they started using it, was that it killed a whole bunch of kids and a whole bunch of animals in the trials. They also knew it wasn't going to stop in any way or hinder or reduce in any way the transmission, the infection, or the severity of COVID-19. Like this all came out, I think, yesterday or 3 days ago. That they knew beforehand that it was going to kill a whole bunch of people. It wasn't going to help in any way. It was going to do serious damage. And yet they let it out anyway. And now I saw a thing Megyn Kelly talked about yesterday that she has credible evidence that they're going to put a black box warning on the COVID-19 vaccine for pregnant women, for babies, and all sorts of things. So remember, the pro-vaccine guys knew it was going to kill kids, knew it wasn't going to help in any way. So they knew it was not safe. They knew it was not effective, but they pushed it out anyway. And they mandated it. And now they're pissy that they're not giving that to babies on, day one. Kind of like they're mad that, all of a sudden we're not forcing babies to have protection for sexually transmitted diseases on day one. My big question on the Hep B deal is, the pro-vaccine guys are so angry. How many babies do you pro-vaccine people think are having sex on day one? And they're like, well, what if they get around dirty needles? All right, so you think that a brand new day-old baby needs the first thing you worry about is sex and dirty heroin needles? What kind of environment do you guys keep your babies in? This is disgusting. So this is kind of where everything is. Oh, everyone's going to die if they don't get Hep B. That's on day one. Like, this is absurd. So, this whole thing is coming up to a position where, people don't trust the medical industry because they've done nothing but lie to us. The whole cholesterol causes heart attacks, that's a lie. When the FDA said that the opioids weren't addictive as long as you bought them from the FDA, opium was no longer addictive. That was a lie. They said psychedelics have no benefit to function, even though we have research going back to the 60s that shows it breaks addiction 85% of the time, the first time they're used. But remember, addiction sells drugs, so we can't break addictions. And then they're coming out and they're saying the COVID vaccine doesn't look like nothing but lies. And so what I think the pro-vaccine people are super worried about is if we quit doing a lot of these vaccines and we start noticing that the rates of autoimmune disease, ADD and ADHD, autism, gut issues, skin issues, psoriasis and eczema in these kids drastically start to reduce, and we all start looking around and going, the vaccines were causing problems. I think that all of a sudden it's going to collapse in on medicine, and we're going to have they're going to have no credibility left at all. Which I think is coming, which is great because, at the end of the day, we need to figure out what is working and what's not. We talked about, again, the medical community, the pro-vax guys think that the COVID vaccine is safe and effective, just like the MMR, just like the Hep B, just like all the other vaccines. They're all the same level of safe and effective. But we just told you, you can go look at the FDA reports, go look at, what they're saying, the actual research that's done. They're not safe. They're not effective. We have that research. We have that data, but that's not what they care about. And then you got guys like Bill Gates who said that they want to, and I've played this clip a lot, where they say that, they want to reduce the population by 15% using vaccines. Ted Turner came out recently and said that we should reduce the population of the planet down to 2 billion. So we should kill 5 billion people. This is what these people are trying to push for. And, to be fair to them, you start looking at, documentaries like The Grab, you start understanding food function throughout the world. That's actually why Russia and Ukraine got into war, was over food. So there's a lot of these things that are pushing out, but we've got to start kind of looking at this stuff and being like, what exactly is going on? Who are we supposed to be trusting? I would be very, very hesitant to trusting people who don't have the research, and the medical guys have zero research on the vaccines. Like that, if you watch any of the trials, with the docs talking about the ACIP, group, talking about, what research do we have? We have none. The 1986, Aaron talks about this a lot. Aaron Siri talks about this a lot. In 1986, they came out and they passed a law that said no vaccine maker can be held liable financially or legally for any vaccine. And the reason they passed that law was because too many people were getting hurt by the 3 vaccines we had, the MMR, the DTaP, and the Hep B, that some people are getting hurt. They're like, look, we're not going to make these anymore because we're getting sued for all the damages it's creating. And they're like, oh, we'll just make you immune to damage. Well, anything that's now a vaccine is classified as immune for prosecution or legal liability. And so, of course, everything is, has become a vaccine, and they don't do any safety testing because it's expensive to do safety testing, and they don't have to because they have no financial or legal incentive to do it. And so that's what this whole argument has been about. So, at the end of the day, a lot of this information is starting to come out, and the pro-vaccine guys are really freaking out because they're really, really worried that, it's not that, that they're worried that kids are going to get sick for 5 days with measles, or that, we're going to figure out that, we could wait till 12 or 13 to give kids Hep B because they're not going to run into sexually transmitted diseases until they, get to the point where they're going to have sexually transmitted function. That's not the issue. The issue is that if all of a sudden people start getting healthier, then we all kind of see ourselves. And my favorite part about this is that all the pro-vaccine guys are like, you should never take, anecdotal information. And anecdotal stuff's worthless. Do you know what anecdotal really means? It means you listen to your patients when they talk to you. So if you see 100 people and they all tell you the same thing, you go, that's something we should kind of look into. It's also part of the scientific method. So this whole it's non-science to listen to what people are telling you, this anecdotal stuff. So the way that, if you guys don't remember the scientific method, it's you state the problem, you form a hypothesis, you gather data. Guess what gathering data is? It's talking to your patients. It's talking to these people and say, how did you feel? What happened? Tell me about what your baby was like this, got a vaccine, then it was totally different. We have video proof of it. That's part of the discovery, part of the function of the scientific method. So just coming out and saying well, just because your patients, 1,000 patients said it, doesn't mean it's something we should listen to. That's the direct function of the scientific method of gathering information, is to literally talk to people and figure out what's wrong with them. So, again, it's funny because when you work with hormone therapy, one of the biggest things you got to do is just talk to your patient. How do you feel? Do you feel better? Well, great. You're at the right level then. You don't feel like, all the things haven't been checked on the box. Great. We need to come up or come down in your hormones. But again, what's the number one thing as somebody who sees patients on a daily basis, the number one thing that I hear is my doctors don't listen to me. That's it. Like I told them and they didn't listen, or I asked for this and they didn't listen. They just gave me these drugs. And so it was, that's kind of where it is. But, if we're teaching our medical doctors to stop listening to anecdotal information, we're telling our doctors by far, you shouldn't listen to your patients what they tell you. Well, it's probably why we're where we're at. So when you're starting to run through this stuff, look at both sides of the argument. The Hep B is an easy one. Hep B, they're like, well, once you get the vaccine, you're 98% covered. You're never going to get Hep B, and it's great. And you're like, all right, cool, that sounds great. How do we get Hep B? Oh, dirty heroin needle, dirty drug needles, not just heroin, and sexual transmission. So you have to have sex with somebody, or you have to have dirty needles. And then you kind of wonder, well, why do we feel like we have to give this to babies? Why can't we wait? Like if your argument was instead of day one, you're like, hey, before your 15 or 16-year-old starts going out and, doing whatever 15, 16-year-olds do, maybe we should give them a vaccine that protects against Hep B. That argument, I don't really have a whole lot of, I think it's a great argument. I think we should have that discussion for real. Why all these medical docs are so insistent that day one babies is a little sick and twisted to me, but it is what it is. I guess on the back end of that whole thing, it's, you go back to what RFK said about what his version of why everybody's giving vaccines is because there's nothing more profitable than a sick kid. And these vaccines, from what the research we're now seeing that's finally being released, research that isn't new research that was done a long time ago, but the FDA and the pharmaceutical companies squashed, like the memo that came out that said the MMR increased autism by 1,134%. That came out not recently, not too long ago, and that research was done a long time ago. And the fact that the COVID vaccine was killing kids and not effective at all, that research was done before they even launched it and just came out now because RFK forced them to release it. So, as we get more information about what they've known the whole time but just haven't cared about, and the idea that nothing's more profitable than a sick kid, those two things do kind of work together. So, that's kind of where things are at. So when you start hearing all this crazy talk, about how, everyone's dying now because, people have mentioned bad things about vaccines, remember a lot of this stuff, like there was measles outbreaks all the time. And an outbreak is like 3 cases in a city. So if like Dallas has an outbreak of measles, 3 cases and 5 million people. So put things into context. A lot of people are trying to scare you into moving, doing things, out of fear. Lots of people are lying to you. The safety of vaccines is now 100%. I will tell you 100% in the area of, if they say they're safe or they say they're not, no one really has that information because no studies have actually been done on this stuff. So like the Hep B vaccine, they took 145 people and watched them for 5 days. That was the trial. That was it. And the problem is that you don't understand some of this stuff. When you look at a study, the more people you have, the easier it is to say out of 1,000 people or out of 10,000 people, this thing happened 1 time or 3 times. And so this is how we extrapolate out what it is. If you just look at people, if 145 people for 10 days or 5 days in this case, you're like, no one died, so they were all fine. Well, a lot of the autism stuff, a lot of the, a lot of the SIDS cases, the sudden death syndrome, they're highly attributed to vaccine use. Those all happen within 5 to 7 days of the vaccine. So if you count day 1 of the vaccine and day, 4, like when they leave the hospital type of thing, as what happened, you're going to miss a whole bunch of stuff, especially if you only look at 145 people. And the big deal is that, and I haven't, seen what they threw away. There's easy ways of doing this to manipulate how you want it. You do multiple groups, and whatever groups have the best outcome, you just throw away all the information. You go, oh, this is the one we're going with. So the research on this is extremely limited. It is not worth making giant claims either direction on. And so I do think we should have a lot more study and a lot more testing on this stuff. Hopefully we'll get it. But until then, I don't know how many times a group can lie to you before you're like, you know what, I'm not going to believe what you say at face value. I need the evidence. And that's kind of where I am with it. So that's kind of where a lot of us are. We're like, okay, stop talking to me and show me the research. Because I love the ones who are like, oh, here's the research that proves they're safe. And you look at it and you're like, this doesn't prove anything. This doesn't even say what you're trying to make it say. Like one guy sent me a research study that it was double blind and the whole deal. And they stopped observing the patients after 4 months. And they're like, okay, it's supposed to be 2 years, but after 4 months, it's fine. It's fine. Because so many people on the other side were getting problems. But kind of keep that in mind, kind of look at the research, kind of look at what's going on. If you guys are in the position where you're about to have vaccines, don't just talk to one side. Get actual informed consent. Go and talk to some of the people. Read the stuff on the high wire. Go read the stuff that Del Bigtree's putting out. Go look at the stuff that RFK's putting out. Child Defense Network. Like, look at that type of stuff. Look at the stuff Aaron Siri's putting out. Like, look at both sides. Because your medical doctor is getting paid for it, and they're really big on it, and they were indoctrinated. They were taught that these things don't hurt anybody ever in any way possible, and they only do good. So, okay, so you have the miracle side, and then you have the we have questions side. So I would look at both before you guys make decisions, but it's not looking good for the research, on proving these things are safe. So if you guys have any other questions, hit us up. Have a great time.